Hey guys, my name is Taylor and I spoke with Reagan. She works at Texas Panhandle Centers in Amarillo. She works primarily with children, but she's had some experience working with adults and mental health as well. She sees the issue that is the most critical in mental health right now to be stigmatization. She said that just the word stigma is, sorry, no, that's wrong. Just the word mental health can create stigmas for both professionals and clients or patients. Professionals often avoid careers in mental health because they see it as scary and it kind of freaks them out or makes them uncomfortable. She said there's a lot of positions at Texas Panhandle Centers right now that are really hard to fill because people are really uncomfortable with getting a job in mental health. She gave the example of schizophrenia. People don't know how to react if somebody is interacting with their hallucinations, and so they become uncomfortable and they don't want a job in something that makes them uncomfortable. She said that they also, a lot of times, people feel like they're going to be put in a more dangerous situation in working with mental health. She also mentioned that clients get a lot of this stigma. They're often less likely to want to continue their medications and treatment because they don't want people to know about their mental illness because of the stigmas. They do their best to hide them and act normal, which generally causes their symptoms to get worse. Reagan sees the second most critical issue in mental health to be misdiagnoses. So she said she sees this most in children. She said by the time people get to be adults, they kind of have their diagnosis figured out and know what's going on with them. But children, two things can kind of look similar. She said that for example, ADHD and anxiety are two things that she sees presenting kind of with some similarities in children. And children don't always have as much understanding about their symptoms, and they don't have the ability to really express themselves appropriately. She gave the example of kids saying that they hear voices, and then when you kind of talk to them and explore with them a little bit more, it's really just kind of hearing their parents, in the back of their head, things they've said, and it's just they don't quite understand that. And similar situations like that where it's just something they don't quite understand yet. Clients are given medication and services directed at their diagnosis, and if it's been misdiagnosed, then nothing happens, nothing changes, nothing gets better. And so clients may give up on their medications and services altogether because they think, well, this isn't ever going to work for me, and really all they need is something a little bit different. She said that diagnosis should be kind of more of a guideline. So, of course, they're important when you're thinking of medications and things like that. But it's important to see the client as a whole person and not just the diagnosis. And this will kind of help limit misdiagnosis if you're making your own observations about people and really meeting the client where they're at. And then finally, Reagan sees the third most critical mental health issue to be people not getting a diagnosis at all. She gave an example of a group that she was a part of, and one client was talking about their experience with schizophrenia. And they were in a stable condition on their medication, but they were talking about experiences they had had in the past, hallucinations, hearing voices, things like that. And another client who was in this group because of substance abuse kind of finally made a connection and had been hearing voices all of her life and didn't realize that wasn't normal, that it was out of the ordinary and that it wasn't something that people didn't experience all the time. So stigmas can kind of come into play here. Again, people not wanting to receive services, get that diagnosis because they don't want people to know, they don't want, those stigmas. But there's other complications. Sometimes people have difficulties finding services due to insurance or just kind of a general lack of knowledge, not understanding the system and what's going on. Or they might, like that client, not really understand what they're experiencing is out of the ordinary. And so if they never get diagnosed, they never get help, and again, nothing changes, nothing gets better. So if somebody finally decides to go ahead and get services, it's usually because they've reached a point where their symptoms are so severe that they have no other choice. Reagan mentioned that once individuals do finally get a diagnosis, it's kind of like the light shines on the rest of their life and everything finally makes sense again. And she believes that helping people get a diagnosis would greatly benefit them. So those are my 3 critical